This video lecture is a continuation of Chapter 37, and in this lecture, we're going to talk about the complications and precautions. The complications can occur during the administration of anesthetic, and being aware of the problems that could occur is going to allow us to know the precautions that we should be taking. So, one of the complications could be injecting into a blood vessel. A local anesthetic solution that's injected directly into a blood vessel can alter the function of vital organs. So, to be certain that the solution isn't being injected into the vessel, you're going to notice that your dentist will aspirate before injecting any local anesthetic solution. With infected areas, our local anesthetic can be delayed or even prevented if the injected area is injected into an area of infection, like an abscess. Because of the inflammatory process surrounding the infection, this lowers the pH and interferes with the anesthetic solution, not being able to penetrate the nerves. Local anesthetic solution is normally tolerated by oral tissues, but for sensitive individuals, the introduction may produce a variety of local tissue changes. Even slight contact with solutions that contain local anesthetic agents can cause some dermatitis. Although local anesthetic solutions are remarkably safe in their use, the importance for systematic toxicity can't be ignored. The major effect that local anesthetic solution can manifest would be on the central nervous system or the cardiovascular system. We can see some temporary numbness. So, because local anesthetic effectively blocks all pain sensation, the patient, especially a child and parent, must be alerted against biting the tongue, cheek, or lip when they're numb. So, once that disappears, as the effect of the anesthetic is going to wear off, because the brain wouldn't be receiving those normal nerve sensations. Paresthesia is a condition in which numbness lasts after the effects of local anesthetic solutions have worn off. And it can be caused by trauma, so injury to the nerve while we're injecting, hemorrhages or bleeding around the nerve, and then use of contaminated anesthetic solution. It can be temporary or permanent. Most paresthesia is resolved within about 8 weeks without treatment. We'll talk next about alternative methods of local anesthetic. So, advanced anesthetic technologies are being used that can help reduce injection anxiety and provide an alternative psychological and physiological approach. So, we hear a lot about painless dentistry or no needle dentistry. So, with these alternative medicines, alternative methods, we have no needles, no post-operative numbness or swelling, chemical free, no risk of that cross contamination. It's going to create reduced fear for our patients, and the patients are in control. So, we're going to talk about electronic anesthesia. It's a non invasive form of anesthetic. The system is designed to block pain electronically with the use of a low current electricity. We use these pads that target a specific electronic waveform directly into that nerve bundle at the root. And then there's a jet injection device that's designed to produce anesthetic using mechanical energy source to create a release enough pressure to push a dose into the tissue without using the needle.